this video, I will be reviewing how to clean your inner cannula as well as some general stoma care. It's important to note at this point in the video that the following cleaning instructions are not appropriate for the inner cannulas for Jackson trach tubes. If you have a Jackson trach tube, please refer to the manufacturer's instructions for proper cleaning guidelines. So the first thing I like to do is collect all of my equipment and make sure I'm ready to go. So I have a box of gloves that I'll be using throughout the cleaning procedure. In this container, I have my clean inner cannula ready to go. I have about 6 packages of sterile cotton-tipped applicators. I've got a new posy tie, because my client uses the posy tie, and also a roll of new twill if your client uses twill. I have a new gauze to go behind the flange of the trach tube. I have a bowl that I'm going to put my saline solution into. I also have another bowl in which I'll put full strength 3% hydrogen peroxide. In this bowl, I'm just going to keep my tracheostomy scrub brush. I have a few vials of saline here as well, and we'll go over what those are for a little later. On the far side, I have my suction machine set up and ready to go. I also have ready my manual resuscitator with a trach adapter as well as a face mask. Okay, so next I'm going to put on a pair of clean gloves. And now I'm ready to start cleaning the inner cannula. So while stabilizing the flange, I'm going to turn the inner cannula, remove it, and place it into my hydrogen peroxide solution. Grab a new inner cannula, put it in, and lock it into place, making sure that the 2 dots line up on the inner cannula and the trach tube. So next thing I'm going to do is remove the gauze piece from behind the flange. And occasionally, if there's mucus or secretions that have come out around the stoma, you may need to put a little bit of saline onto the gauze to ease with removal. So we're just going to work it down. It's important at this point to just take a look at the gauze. You want to note if there's any blood or pus or any foul odor that is something new for your client. If there is an infection, you may need to contact your doctor and get some prescribed medicated cream. So that's garbage. The next thing I'm going to do is put 4 to 5 of the sterile cotton-tipped applicators into my saline. So using the cotton applicator, I'm going to bend the flange forward, and I'm going to clean around the stoma in quadrants. So I'm going to start with the top right-hand side, and I'm going to go in and sweep out. And this is now garbage. I'm going to repeat this all the way around. Next, going to the top left. Bottom left. And the bottom right. So while I'm doing this, I'm also taking note of the stoma and making sure that there's no new inflammation or new infection going on. With the last cotton applicator, I'm going to clean the back of the flange. Okay. So I'll open 4 more dry cotton applicators, and with these, I'm going to dry the skin around the stoma. I'm going to start on the right upper. Dry the skin. If your client is using a medicated cream, this is the time that you'd want to apply it. And you'd want to apply it the same way that we cleaned, from the stoma and out in 4 quadrants, using 1 applicator per swipe. So next I'm going to change my client's posy ties. And if you have an extra set of hands around, this is a good time for them to help you out. But if not, it's not a problem. You want to hold on to the flange and make sure that this is stable at all times. I'm going to loosen one side and remove it. And put in my new posy tie. Remove the other side. And re-secured. You want to make sure that your posy ties aren't so tight on your client. You should be able to get about 2 finger widths between your client's neck underneath the posy tie. Okay, so that looks appropriate. And the last thing I'm going to do is put a new gauze underneath the flange. This is client specific, so some clients won't use a gauze and others will. Just know what your client likes. So we're going to slip it underneath. Oops. Okay. Okay, so now my stoma care is complete, and I'm going to start cleaning the inner cannula. So at this point in time, the inner cannula has been soaking in my hydrogen peroxide solution for about 10 to 15 minutes, and because my gloves are now soiled, I'll change those to clean my inner cannula. So using my trach brush, I'm going to clean any secretions out from the inside of the trach tube. You can also use it to scrub the outside. And notice that I'm only holding the white connector of my inner cannula. And so now that the trach tube has been cleaned with hydrogen peroxide, I'm going to rinse it off in my saline solution. Give it a little shake and put it back into my pre-prepared clean container. Once that's air dried, it's ready for use for the next cleaning session. Now I'll just dispose of everything, clean up, and we're finished.